There's a really, really simple tool that leaders can deploy. It's really easy and simple, and it goes like this. Do you ever feel like as a leader that you're trying to put 3 gallons of water in a 1-gallon jug? I promise you, if you feel that way, then your employees do too. It's one of those things that just cascades down through an organization. And what research and studies have shown is that it's one of the top drivers of workplace anxiety, panic, and depression. I spent many, many years as a CFO and as a senior operations leader struggling with anxiety, panic, depression, and I didn't even know it. The stigma of the illness was so strong that I had no awareness of how ill I was. I just felt really, really, really unhappy. And boy, was I always fearful and mostly angry. And what I want to do today is share with you one of the best tricks I have ever found that helped me manage my anxiety at work and be a great leader at the same time. I'm not professing any brilliance here. This was completely accidental in discovering this, but it's a simple tool that all leaders and all staff can use immediately. As soon as you stop this video, you can start using this tip. And it will help you create psychological safety amongst your teams. It will create capacity amongst your teams. It will flow through your organization once you start talking about it. Studies show that it's workload. That's one of the top drivers of workplace anxiety, panic, and depression. If you're one of the 20% of people in America who struggle with anxiety, depression, panic every year, then that sense of doom, of fear, of terror is prevalent and gets stoked when it's sitting in the face of this workload that feels unrealistic and unreasonable. There's a really, really simple tool that leaders can deploy. It's called Leadership Continuum. And it's really easy and simple. And it goes like this. Whenever a leader opens their mouth and says something, they're like a human starting pistol of a running race, right? People just want to perform for them. They say something and their teams want to impress. People are jockeying for resources. And the thing is that when a leader opens their mouth and shares their thoughts, on the one hand, sometimes they're sharing a wacky brainstorm idea. And sometimes they're really saying, look, if you don't do this by tomorrow or next week, your job's on the line. Your bonus is on the line. And it's this continuum. Every time a leader opens their mouth and shares their perspectives, their thoughts, their ideas, it's somewhere on this continuum. Unfortunately, my experience has been that they rarely tell you where they are on the continuum. So what happens is wacky brainstorm ideas that a leader might share in a conversation is interpreted by the audience as a must-do. And so it just adds more work onto the organization that oftentimes really isn't necessary. Now, let me give you what I think is a funny story. It's actually the story where I figured this out. So this was about 7 years ago. I had no idea how sick I was. I was accountable for what I call the factory of a health plan. I had so much on my plate. Our teams were balancing and juggling. I was always in a state of panic, regular panic attacks. It was scary. I was just terrified constantly. And I was sad and depressed. I didn't like my work. It was horrible. One day I was having a regular monthly one-on-one with my executive leader. And in the middle of the conversation, he shares this other project that he was interested in my team working on. And on the inside, I started boiling. I'm like, oh my God, we just spent 25 minutes talking about everything that we're doing. And I started with, I don't think my teams can handle one more thing. what do you mean you want us to take this on? It sounds really nice, but it sounds like a nice to have to me. Now, all that's going through my head as I'm sitting there. And really, I'm just wondering, I didn't know this at the time, but I think I was subliminally wondering, am I going to have a fight interaction or a flight interaction right now? Because it's always going to be fight or flight in a face of anxiety. I have no idea how this happened. It was a complete accident, but I just opened my mouth and this is what came out. It came out calmly. To this day, I have no idea how it was this simple. And I said, David, okay, so it was my boss, David, help me understand. Is this like a wacky brainstorm idea that you're sharing with me? Or is that like you really want my teams to work on it? And he goes, oh no, it's just a wacky brainstorm idea. I mean, if you're interested in it, then you can work on it. But I'm sorry, the way I had framed it implied that I needed you guys to run with it. I don't want to cause you any concern or worry. Just a brainstorm idea. I was blown away. And then I started thinking about experiences that I had. So years before, I was the CFO of a hospital and of a couple $1 billion care delivery system. Hospitals, clinics, pharmacies, labs, that sort of stuff. My job was to make sure that the care delivery part of this organization hit its financial targets. And by every once in a while, I mean pretty regularly, financial analysts would come to my office to ask me to review a proposal and an analysis that they were putting together for an operations leader. And I'd look at them and I'd be thinking in my head, these analytics are brilliant, but its brilliance is only outpaced by its irrelevancy. I'm thinking, why are they working on this? It's not in our company strategy. It's not something that we would do. And I appreciate the intellectual work that was put into it. So I asked a handful of times, I'm like, so why are you working on this? And the answer was almost always, I was in a conversation with blah, 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 the outpatient leader or the hospital surgical services leader. And I mentioned that I thought something like this might be a good idea. And they looked at me and smiled and said, yeah, that sounds great. I'll see you later. Or it was in a one-on-one and they just kind of smiled, nodded, and they were writing it down. And they said something like, well, that seems like a neat idea. We might want to think of looking into that. The employee then interpreted those comments, which were wacky brainstorm idea comments, as, I think that's a really good idea. You should go work on that. That employee then spends hours, days, putting a comprehensive due diligence together. They probably, to put the analysis together, had to take physicians out of practice, had to take surgeons out of surgery, had to take nurses off the floor. The cost of just doing this wacky brainstorm analysis on a care organization, just in terms of the lost workload amongst clinical staff that you need for expertise to make a good due diligence case, it's beyond comprehension. It's thousands of dollars, tens. I can easily see as an ex-CFO as how chasing down a wacky brainstorm idea analytically in a healthcare environment could cost tens of thousands of dollars. So that moment in David's office, and then reflecting upon my experiences, what it taught me as a leader is anytime I ever open my mouth, I'd say, hey, I'm sharing a wacky brainstorm idea. Or, hey, I'm sharing a brainstorm idea, but I think it's a really good one. Or, hey, you know what? I think this is a very important piece of work for our organization, and I'd like to help you figure out a way to prioritize it highly. Or, we need to do this by tomorrow. And then what I found was I'd be in meetings all over the organization, and I'd hear people saying, hey, this is just a wacky brainstorm idea. I'd hear another leader on my team say, this is really important. I want us to do this. Another funny story is every conversation I ever had with my boss or any other leader in the organization that asked our teams to take on work, if it didn't make sense to me immediately what they were asking for and why, and to understand its importance, I would always say, all right, so help me understand. Is this a wacky brainstorm idea, or do you really want us to do it? I think I used this for 7 years before I started Simple Mental Health. And I can probably count on one hand how many times someone didn't say, oh no, it's just a wacky brainstorm idea. What that taught me was all over organizations is this waste. We study Lean Six Sigma. How do we become process improvement professionals? We try to figure out how do we eliminate waste out of the system. And all of our teams, no matter what you do, work as a system. The number one goal of any process improvement is to eliminate waste. And work that's not necessary is waste, period. What I hope you took away from this video is a really simple and powerful tool. Its power is not just in improving the performance of the team, reducing unnecessary work, reducing the cost of due diligence. But the real power is that it helps people feel better. It helps reduce a feeling of stress, a feeling of overarching doom that accompanies the people feel in their emotions so often when they're facing that scenario where they're being asked to put 3 gallons of water in a 1-gallon jug. It's something that leaders can use to make it easier for everybody on their teams. It's something leaders can use to help mitigate anxiety and panic. But it's also something that staff can use. Remember, I would ask my boss, hey, is that a wacky idea or do you really need me to do it? Thinking about that leadership continuum, it's simple. It spreads like wildfire throughout your organization. It creates a sense of psychological safety amongst your teams because they know what's really important. And when you're just spitballing ideas with the boss, it helps those brainstorm conversations improve, helps team productivity, it reduces cost. Using the leadership continuum is so easy. You can start using it as soon as you stop playing this video. Just whenever you share your ideas with people, just share, hey, it's a brainstorm idea. Hey, this is what I really need you to be working on. It improves the mental health of your employees and improves productivity all at the same time. If you need any help, you want to chat about it, give us a call, shoot us an email, and please follow us on social media at Simple Mental Health.